My role here at Washington Hospital is to assist community members in navigating their health insurance.
When you retire, you got so many choices you got to make insurance-wise, and it's really a trying period of your life.
When you get to a certain age, you need trust, and to know that I can trust somebody who's interested in my health and welfare, it to me is a blessing in disguise.
What I find most rewarding about my job would be the people that I'm able to serve. Our service here is a free service to the community, and when people come in, they're usually pretty nervous, pretty upset. Perhaps they're having to make a big decision, or they've lost their insurance and they feel like they're not going to have health care, which is very scary. Some people have pre-existing conditions and they're seeing doctors, and some worry about their future. It's very important to have health insurance. I really can't stress that enough. I run across people who decide to go uninsured because they're healthy, and everybody's healthy until they're not healthy. You can't just jump into health insurance. You have to wait for open enrollment. Sometimes there's government programs that can help, like Medicare, until open enrollment rolls around, and then they can choose a plan. So an HMO and a PPO are the primary plans in our area. So a PPO is a preferred provider organization, which typically allows you to go wherever your insurance company is contracted with. For a lot of people, it's very important for them to stay with the same doctor, and also their local hospital. So that is something I have them consider. An HMO is a health maintenance organization, which you choose a medical group, so you have to stay within that group. We're lucky living in the Bay Area to have so many great doctors and facilities to be able to go to. We have such great specialists. I've been here for 9 years, and I've seen a lot of growth, a lot of change, and it's been so positive.
She'll have your hair fixed in the back.
Well, hello.
Hello.
We're back.
I think it is important to have an advocate when you're choosing a health insurance plan, especially with Alice and Joe with Medicare. What happens is when you turn 65, you get a lot of mail, you get a lot of insurance companies contacting you, and that's fine, but each one of them is trying to sell their plan. Our service is an unbiased service, and when people come to me for their Medicare choices, I help them map that out in the very beginning so that they know what they're looking at for their future.
When you retire, you got so many choices you got to make insurance-wise, and it's really a trying period of your life. So we came over here, we didn't know what kind of insurance to get, what we needed, and prescription drugs and so forth. You know, that's quite a challenge.
All the different programs, and we really avoided some costly mistakes, really did.
You're getting in your 75, close to 80, and these existing conditions can wipe your life savings out. So we gave her all of that information, and she brought us in and presented the programs when we met with her, and you know, you got that warm fuzzy when you left. And not only that is you knew she was working for you, not
an insurance
a representative for an insurance company.
You can be so easily taken advantage of without a program like that. You know, you don't have to like jump through 3 hoops to be able to see someone here. So that was wonderful too.
How are you? Good to see you.
Talking to Christy, who has helped me at my health insurance, has been a blessing. Being single and a senior, my budget is limited, and so she's helped me with the medication and what insurances would pay that would do full coverage rather than out of pocket. And since I'm diabetic, medicine does get expensive, and she knew which category and insurance would fit my budget, fit me as well. I'm very happy with the choices she presented to me and the choices that I made. It's like a giant load off your chest. I don't have to worry about that. You know, the older you get, your health doesn't go the way you want it to go. Things change, and every time my doctor does the change, I'm fine. The insurance takes care of everything. So I'm happy. I'm a happy camper.
Learn more at BayAreaHealthierTogether.com.